Once again, welcome back to a new video of obstetrics and gynecology. Today, actually, we are not discussing about an obstetrics and gynecology topic. We are going to discuss about a topic which is related to the pediatrics. We are going to see the fetal circulation and the major circulatory changes that are occurring in the fetal body after the birth. And through this video, I'll be describing the normal fetal circulation, and I will just mention what are the major changes that will occur in the placenta and inside the fetal body after the birth of the baby. So now let us see the fetus. The term fetus is used to refer the prenatal mammal between its embryonic state and its birth. That is, before the birth of the baby will be called as fetus. And the placenta is the organ which is supplying oxygen and other nutritive material for the fetus, and it helps for the elimination of carbon dioxide and other nitrogenous waste materials from the body of the fetus. And the umbilical cord is the connection between the fetus and the maternal side, and it's having two arteries and one vein, and it helps for the elimination of carbon dioxide, and it gives oxygenated blood to the baby, and at the same time it supplies needed nutrients and vitamins to the baby. Now let us see the fetal circulation. The circulation of oxygenated blood, deoxygenated blood, nutritive material, extra in the fetus is termed as fetal circulation. Now let us see the role of placenta in the fetal circulation. See, the respiratory center of the fetus is not well developed during the pregnancy, during the fetal stage. So here the placenta is acting as the respiratory center for the fetus. That is, it is helping for the exchange of oxygen and carbon dioxide. The deoxygenated blood from the baby will come to the placenta through the umbilical artery, and from the placenta the exchange of oxygen, carbon dioxide and oxygen will occur. That is, this deoxygenated blood which is coming from the fetus will leave up the carbon dioxide over there in the placenta, and it will absorb oxygen from the placenta, and it will go back to the baby through the umbilical vein. So this is the thing which is happening inside the placenta. And if we know the placental development and placental structure, we can see that there is no direct connection between the maternal blood and fetal blood. There are around 4 membranes, 4 layers which are separating the placental circulation and the fetal circulation. In case if you are having any doubt, you just go through the previous video about the fertilization. In that structure of placenta I have explained. Next is fetal lungs. Fetal lungs, pulmonary vascular resistance is the resistance offered to the blood through the lungs. The resistance is very high in the fetus because of the non-functioning fetal lungs. Because of this high pressure, the blood is delivered from the pulmonary artery into aorta. So the fetal lungs is not taking part in the respiratory process or in the exchange of carbon dioxide and oxygen. Actually, it's a fluid filled cavity. Fluid also will be there in the lungs during the fetal stage. So the deoxygenated blood from the fetus is not going to the lungs for purification as like in the adults. Instead of going to the lungs, it is getting bifurcated from the pulmonary artery directly into the aorta. It's not actually, the pulmonary artery is supposed to go to the lungs, but here it is not going to the lungs, it is going directly into the aorta. Next, we can see the blood vessels in the fetus. The blood vessels which are responsible for the fetal circulation are umbilical vein and umbilical artery. Umbilical vein, it carries, already I have told you, it carries oxygenated blood from the placenta to the growing fetus. This umbilical vein, it is red in color. There are 2 arteries and 1 vein in the umbilical cord. This 1 vein carries the oxygenated blood from the placenta to the fetus. The blood pressure inside the umbilical vein is approximately 20 mm of mercury. Next structure is umbilical artery. It carries the deoxygenated blood from different parts of the fetal body, and from there from the fetal body, it will collect the complete deoxygenated blood, and through the two umbilical artery, it will reach to the placenta. That is, from the fetal body, it will come to the umbilical cord. From the umbilical cord, it will reach the placenta. There, it will supply the deoxygenated blood to the placenta. So, the carbon dioxide will be going to the placental side. The deoxygenated blood with the carbon dioxide, it will be supplied to the placenta. So, this is the function of the umbilical artery, and there are two arteries. Next, shunts involved in the fetal circulation. There are three shunts present in the fetus. They are ductus venosus, ductus arteriosus, and foramina ovale. So let us see these temporary structures. First one is ductus venosus. This ductus venosus is a shunt between the umbilical vein and the inferior vena cava. So the umbilical vein, we know that it is with the oxygenated blood. So it allows oxygenated blood from the placenta to bypass the liver, and it will go directly to the fetal right atrium of the fetus or fetal heart. So that is the function of the ductus venosus. The blood which is rich in oxygen, which is coming through the umbilical vein from the fetus side, it will just merge with the through the connection ductus venosus. It will enter into the inferior vena cava. So this ductus venosus is the connection between the umbilical vein and the inferior vena cava. And next temporary structure is the ductus arteriosus. It is otherwise known as ductus botali, and it is a connection between the pulmonary artery and the descending part of the aorta, proximal descending aorta. So in the normal cases, in the adult circulation, we know that blood from the right ventricle will go to the pulmonary artery, and through the pulmonary artery it will goes to the lungs, and it will get purified over there, or it will absorb oxygen from the lungs. But here this blood is not going to the lungs for the absorption of oxygen. Instead of that, because it is the oxygenated blood only, it is coming from the placenta, it is with a rich amount of oxygen. So it is not supposed to go, and more than that, the fetal lungs are not functioning. So what will happen? The oxygenated blood from the right ventricle, it will enter into the pulmonary artery, and there is a connection between the pulmonary artery and the aorta. Actually, aorta is the artery which is supplying oxygenated blood all over the body. We know the normal circulation in the adult. So this pulmonary artery is having a connection between the aorta. So this oxygenated blood which is coming from the fetus will be supplied to the aorta through this connection, and this connection is ductus arteriosus, connection between the pulmonary artery and the descending aorta. So here you can see this picture. This picture shows the fetal circulation. This is the umbilical vein. Umbilical vein, we know that it carries the oxygenated blood. Umbilical vein, it's coming like this. These are the two umbilical arteries. These are carrying deoxygenated blood from the fetus to the placenta. So first let us see what is happening to this umbilical vein. See, the umbilical vein, it's coming from the placenta. It carries oxygenated blood, and here when it is reaching here, this is the inferior vena cava. There is a connection between this umbilical vein and the inferior vena cava, and this connection is the ductus venosus. So this oxygenated blood, now it has entered into the inferior vena cava, and from the inferior vena cava it is going to the right atrium, and from the right atrium it will go to the right ventricle, and from the right ventricle it will enter into the pulmonary artery. See this blue colored one, pulmonary artery, and from the pulmonary artery, this is the aorta. This yellow or orange color one is aorta. So this is the descending part of the aorta. This pulmonary artery, you can see here, there is a connection between the pulmonary artery and the aorta. That connection is the ductus arteriosus. So the blood which is coming from the fetal side will enter into the pulmonary artery, and it will go to the aorta through the ductus arteriosus, and it will be supplied to the lower portion of the body. And the upper portion of the body is supplied by these two branches of the ascending aorta. So now let us see how this portion is getting blood. The blood which is entering over here in the descending part will be supplied to the lower portion, and we should see how the lungs are also getting blood. Actually, when the blood is entering here, some amount of blood is going to the right ventricle. And we know that there is a connection between the right atrium and left atrium, that is foramen ovale. That is not there in the adult. In the fetus, already we have seen that there is a temporary structure, or there is a connection between the right atrium and the left atrium, that is known as the foramen ovale. Through this opening, the blood from the right atrium will go to the left atrium. So the oxygenated pure blood from the right atrium will go to the left atrium, and from the left atrium it will enter into the left ventricle, and from the left ventricle it will go to the aorta. So the maximum oxygenated blood will enter into the aorta, and it will be supplied to the upper portion, to the brain and other upper parts of the body. So this is the overview of the fetus circulation. So the explanations I will give you once again. See, foramen ovale is an opening in the intra-atrial septum. Already I have told you that. So it allows the blood to enter from the left atrium to the right atrium, from the left atrium to the right atrium, and it is also called a false septate. So here that connection is there. See this picture. From here, through this opening, it is going to the left atrium from the right atrium. Okay. Okay, already I have explained the fetal circulation, but now once again I will tell it step by step. In the first step, the placenta receives the impure blood, that is blood without oxygen. That is, we are here for the easy understanding, we are calling it as bluest blood, because it is coming through the blue colored veins in the picture. So blood without oxygen, it will come through the umbilical arteries, and from there it will come to the umbilical cord, and it will get supplied to the placenta. So the placenta is getting deoxygenated blood from the fetus through the umbilical arteries. That is the first step. And second thing, when blood goes through the placenta, it absorbs oxygen, and it will become oxygenated blood. Here for the easy understanding, I have marked it as red blood. It will become red blood. So it will be oxygenated blood. So that is the second step. So the exchange of oxygen and carbon dioxide is happening in the placenta. Okay. See, in this picture, I will tell you that these two umbilical arteries, see, it is coming from the fetal body. This is the fetal side, and this is the maternal side. Here placenta is there. This is the umbilical cord. Okay, this structure is the umbilical cord. So these two arteries collects deoxygenated blood from the baby, and through the umbilical cord it is coming to the placenta, and it will supply, or it will leave up the carbon dioxide in the placenta, and from there it will absorb oxygen. The blood which is rich in oxygen will enter through the umbilical vein, and it will come to the fetus side. Okay, so now it has reached up to here. The oxygenated blood has reached into the umbilical vein. Now let us see the third step. The blood which is coming through the umbilical vein, it will come through the umbilical cord, and it will reach up to the umbilical cord. So that is the third step. Then in the fourth step, the blood that enters into the fetus through the liver and through the right, so through the inferior, see, already I told you that there is a connection between the umbilical vein and the inferior vena cava, and the inferior vena cava is supplying to the right atrium of the heart, right side of the heart. So from the inferior vena cava, it will go to the right side of the heart, and one branch is supplying to the liver also. And in the next step, already I told you that there is a connection between the right atrium and the left atrium through the foramen ovale. So this blood with rich oxygen will go to the left atrium, and from there it will go to the left ventricle, and from the left ventricle it will enter into the aorta, and as a result the brain and other upper parts of the body gets maximum oxygenated blood. See, here it has reached up to here. This is the ductus venosus, connection between the umbilical vein, umbilical vein and the inferior vena cava, and it will go to the heart. It will reach the right atrium, and some amount of majority of the blood will enter into the left atrium through the foramen ovale from the right to the left through the foramen oval, and from there it will go to the left ventricle, and from the left ventricle it will enter into the aorta, and this will be supplied to the upper parts of the fetal body. So the upper parts of the fetal body is getting maximum oxygenated blood. Now the next step is, in the next step, the blood which is coming from the fetal body also enters to the right atrium, but the fetus is able to send this blue blood from the right atrium to the right ventricle. So some amount will go to the right ventricle also, and actually from the right ventricle, in the normal case, if it is an adult circulation, it will enter into the pulmonary artery and it will goes to the lungs. Here also it will enter into the pulmonary artery, and from the pulmonary artery it has to go to the lungs normally, but here already I told you that there is a connection between the pulmonary artery and the descending part of the aorta, that is ductus arteriosus. So it is bypassing the lungs. So the balanced blood which is coming to the right ventricle will enter into the pulmonary artery. From the pulmonary artery, through the connection between the pulmonary artery and aorta, that is through the ductus arteriosus, it will enter into the aorta, that is descending part of the aorta, and it will supply to the lower portions of the body. See, balance amount of blood, it is coming from the right atrium to the right ventricle. From the right ventricle it will enter into the pulmonary artery, and there is a connection between the pulmonary artery and the aorta, that is ductus arteriosus. Through the ductus arteriosus it will enter into the descending part of the aorta, and it will be supplied to the lower parts of the body. From the lower parts it will supply oxygen over there, and it will absorb maximum carbon dioxide, and with this deoxygenated blood with carbon dioxide again will come back through the umbilical arteries. So the ductus arteriosus send this oxygenated blood to the organs in the lower half of the body. This will supply to the lower part, and from there it will absorb carbon dioxide, or it will receive all the waste material, and it will come back to the placenta again to leave the carbon dioxide and waste materials and to absorb the oxygen. So this is the thing which is happening in the fetal circulation. Okay, once again I will explain it. The blood which is coming from the placenta, that is oxygenated blood, will come through the umbilical vein. Through the connection between the umbilical vein and the inferior vena cava, that is ductus venosus, it will go to the right atrium. From the right atrium, there is a connection between the right atrium and left atrium through the foramen oval. So it will enter into the left atrium. From the left atrium, it will enter into the left ventricle. From the left ventricle, it will enter into the aorta, and it will be supplied to the upper portions of the body. And some amount of blood from the right atrium will go to the right ventricle, and from the right ventricle it will enter into the pulmonary artery, and instead of going to the lungs, it will be it is just diverted into the aorta through ductus arteriosus, and it will be supplied to the lower part of the body. So this is a summary of fetal circulation. Now let us see the circulatory changes that is happening after the birth. See, in the adult body, we know that we don't have this ductus arteriosus, ductus venosus and foramen oval. So we should see what is happening to these temporary structures. The placenta will be replaced by the lungs. So the respiratory center will become the main respiratory organ will become the lungs instead of the placenta. The lungs and the pulmonary vessels will expand, and the resistance of blood flow through this artery will decrease. So subsequently the pressure inside the pulmonary artery and the right side of the heart will decrease, and at the same time, when the blood is going to the lungs from the pulmonary artery through the pulmonary artery, it will come back to the left atrium. So inside the left side of the heart, pressure will increase. So this is the pressure change which is happening. So now let us see what is happening to the shunts. The ductus venosus closure will occur, foramen oval also will get closed, the ductus arteriosus also will get closed. The ductus venosus will close functionally within minutes after the birth, and structurally it will get closed between 3 to 7 days, and after closure, the remnant is known as the ligamentum venosa. The closed ductus venosus will be named as ligamentum venosum. It will occur, anatomical closure will occur between 3 to 7 days after the birth. Closure of ductus venosus is caused by the strong contraction of muscle wall of the ductus venosus, but the exact cause is unknown. Anyway, the ductus venosus will become ligamentum venosum and it will get closed after the birth. Next is the closure of the ductus arteriosus. The ductus arteriosus closure is also occurring by the smooth muscle contraction, and after the closure it is known as ligamentum arteriosum. The ductus arteriosus after closure is known as ligamentum arteriosum. At birth, opposite direction of blood flow from the aorta to the pulmonary artery supplies more oxygenated blood than before. This contraction of smooth muscle occurs because of the increase in availability of the oxygen. The degree of smooth muscle contraction is highly dependent on more availability of the oxygen. Because of the high availability of the oxygen, this will get closed. And next is the closure of the foramen ovale. Already I have told you that when the blood is going to flow to the lungs, there will be return, that is from the pulmonary artery, blood will go to the lungs for purification, and from the lungs it will come back to the left atrium. So what will happen inside the left atrium? Pressure will increase. So due to the high pressure, this flap or that opening will, that muscle will get closed. So due to the high pressure in the left atrium, the foramen ovale will get closed, and that is a reason for the closure of the foramen ovale. So before the birth, the foramen ovale allows the oxygenated blood entering in the right atrium from the inferior vena cava to pass into the left atrium. Closes at birth due to decreased flow from the placenta and inferior vena cava to hold the foramen open. More importantly, because of increased pulmonary blood flow and pulmonary venous return to the left heart, causing the pressure in the left atrium to be higher than the right atrium. This increased left atrial pressure then closes the foramen ovale against the septum secundum. The output of the right ventricle now flows entirely to the pulmonary circulation. So that is the closure of the foramen ovale. Now let us see the fetal circulation once again. This is the placenta and this is the umbilical vein. These two are the umbilical arteries. From the umbilical vein, the oxygenated blood will come to the fetal side and it will enter into the inferior vena cava of the fetus through the ductus venosus, and through the inferior vena cava it will reach to the right atrium. From the right atrium, through the opening of the right and left atrium, that is foramen ovale, it will enter into the left atrium. From the left atrium it will go to the left ventricle, and from the left ventricle it will be supplied to the aorta, and this will get supplied to the upper portion of the body, especially to the head and other areas. And some amount of blood from the right atrium will enter into the left ventricle, and from the left ventricle it will enter into the pulmonary artery, and from the pulmonary artery there is a connection between the pulmonary artery and the descending aorta, that is ductus arteriosus, and it will enter into the descending aorta and it will be supplied to the balance part of the body, especially the lower part of the body, and from there it will absorb deoxygenated blood, and this deoxygenated blood will be supplied to the placenta. Okay. So this is the thing which is happening after the birth. After the birth, we will just cut the umbilical cord. So what will happen means closure of this ductus venosus will occur. So here immediately, because of the pressure change, closure of the foramen ovale also will occur. Here also, because of the muscle contraction, closure of the ductus arteriosus will occur. So here the normal circulation will start. Fetal lungs also will start to function. So the blood which is coming from the superior vena cava and inferior vena cava will enter into the right atrium. And from the right atrium, we know the normal arterial circulation. It will go to the right ventricle. From there, it will enter into the pulmonary artery. It will go to the lungs for purification. After purification, it will come back to the left ventricle, left atrium. From the left atrium, it will go to the left ventricle, and from the aorta, it will be supplied to the complete body. So this is the changes which is occurring in the circulation after the birth. So thank you for watching this video. Bye.